Thanks so much for watching Colorado's Best. I'm Joanna Canals.
And I'm Paula Haddock. Say goodbye to pills and hello to hope. Inspire TMS Denver is revolutionizing the way doctors treat depression and other mental health disorders.
There's no surgery, no medication, and no side effects. Let's welcome in Dr. Sam Clinch from Inspire TMS Denver. We are so glad to have you here today.
Yeah, I'm glad to be here.
Thanks
it's
for
exciting.
joining us.
Thank you.
So tell us what is TMS therapy and how it works?
Yeah, absolutely. So TMS therapy stands for transcranial magnetic stimulation, and this is a outpatient medical procedure that's primarily used to treat major depressive disorder as well as other mental health conditions, but primarily major depression. It is as I said, a non-invasive procedure. It's done in an outpatient clinic, requires no medications, no sedation to deliver the treatment. It was FDA approved for the treatment of major depression in 2008. It's also gained additional indications in 2018 for OCD, or obsessive compulsive disorder, as well as smoking cessation. Yeah, it's a really effective treatment that can be really beneficial for people who haven't responded to typical treatments for major depression. So we're talking about medications and therapy. And so for people who haven't responded to those treatments, it can be a really effective treatment.
So if they've tried those other treatments, why TMS? Why turn to it?
Yeah, so, unfortunately, we find that patients may not respond to standard treatments always. So about a third of patients over time won't respond to medications and or therapy. So we need to have additional treatments to help these patients that are suffering with depression. And so that's where TMS comes in. It's a really great treatment that can be very helpful.
So how does somebody know if they're a good candidate for this therapy?
Yeah, sure, absolutely. So most of the studies involve patients who are 18 years or older, so above the age of 18, people who have had depression, specifically treatment-resistant depression, so they haven't responded to, usually we say 2 medications and therapy. This is usually what insurance requires in order to proceed with treatment. There's very few contraindications to treatment, but one of them would be any history of epilepsy or seizure disorder. The treatment uses magnetic fields or pulses to stimulate an area of the brain that has been shown to be deficient in people who have depression, so hypoactive. So essentially we use a coil or magnetic wiring. We run electricity through the wiring, and it's encased in a plastic housing. This is placed on a certain area of on the cortex of the brain or the scalp to stimulate tissue that's not working effectively. And so those are that's kind of how the treatment works.
Yeah, and we're kind of seeing video of it, one of the treatments being done. And you mentioned insurance. Is TMS covered by insurance, and how much does it cost?
Yeah, so it is covered by insurance. How much does it cost to the individual patient really depends upon what insurance coverage you have. As long as you meet their prior authorization, we can typically get insurance to cover anywhere from the entire treatment up to you may have additional like co-pays or co-insurance that you have to contribute to the cost of treatment. So it could be $0, maybe a few $100s. It can be thousands of dollars for some people. We do have self-pay options and a sliding scale as well if insurance does not cover the treatment, or if we're seeking an off-label treatment or non-FDA approved indication.
So how many sessions before people start seeing results?
Yeah, it can be quite variable. Oftentimes we'll see as little as 10 sessions. People can start to improve. The standard treatment course does involve 36 sessions, and this usually occurs over 30 sessions over 6 weeks. Okay. You come in 5 days a week on the weekdays for a single treatment. And then there's 6 sessions at the very end to do like a taper off of the treatment. So it can take as little as 10 sessions, but typically, the most robust response would be to complete a full treatment course, which would be 36 sessions. There's also accelerated treatment courses that are available.
What's that?
Yeah, so an accelerated treatment course is an additional 14 treatments. So you're getting 50 total treatments, and it involves some changes to the standard protocol. But you come in for just 1 week of treatment. It involves 10 treatments over each day. So you come in and you get a treatment that lasts about 9.5 minutes. Then there's a 45-minute break, and then another treatment after that. So 10 treatments total over 5 days, 50 total treatments, and you can be free from depressive symptoms and other associated mental health symptoms in as little as 5 days.
Wow, just fascinating. We could
great.
talk to you
Thank you.
a long time, but we'll have to have you back and dig a little deeper into it. But it's
Sure.
really fascinating. So if you are ready to try a new treatment for your depression, anxiety, or maybe other mental health disorders, call Inspire TMS Denver. They accept all major insurances, including Medicare. So for those without insurance, Inspire TMS Denver offers a sliding scale payment based on household income. You can learn more at inspiretmsdenver.com or give them a ring at 720-446-8675 to schedule a free phone consultation.
Colorado's Best will be right back.